Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Super excited to have Dr. Sun on the show today. So Dr. Sun brings deep clinical experience and personal insight to her practice. After facing her own challenges with menopause, gut health, and the shortcomings of conventional care, she sought out evidence-based root cause solutions that transformed her health and the health of her patients. Her approach blends personalized nutrition, detox, bioidentical hormone therapy, regenerative medicine, and lifestyle strategies to help patients overcome fatigue, hormonal imbalance, GI dysfunction, and more. She's also the author of Vitality Now, a comprehensive guide to anti-aging, rejuvenation, and vibrant health, a book that captures years of clinical experience and integrative wisdom to support those looking to optimize health and longevity. In today's conversation, Dr. Sun shares how she helps patients go from burned out and imbalanced to energized, vibrant, and thriving with practical, science-based tools providers can use in their own practices. So excited to have you on the show, Dr. Sun.
Me too. Thank you for inviting me.
And I love the fact that you really, when you found out about me and what I was doing, you really felt passionate about talking to other providers. A lot of times when I have functional and integrative medicine doctors, they still feel very much shunned by the medical community. And so, they'll share their experience, but you were like, yeah, let me at them. Let's talk. So let's go ahead and get started. So first, let's kind of give everybody a little bit of, background. So what inspired you to transition into functional, integrative, holistic medicine, especially as it relates to your own experience with adrenal, burnout, and women's hormonal health?
Ginger, I have to be honest with you. 20 years ago, I reached menopause in my early 50s. And I was also burned out from practicing conventional medicine because my background is internal medicine. So I have a lot of older men and women in my practice. And what I see is the toolbox I have was only drugs. And they are taking multiple drugs, diabetes medicine, blood pressure medicine, cholesterol medicine, antidepressants, sleeping pills, pain medicine. They're like walking pharmacy. And their quality of life was not good. And also around by insurance company, their reimbursement was very low for internist. And hands were tied. So I was so burned out, I was ready to quit practicing medicine. There's no joy for me. And happened to me, I reached menopause, hot flash, and sleep. And I was tired. I was even depressed. So I went to see my gynecologist. And her solution was, take birth control pill. You're rich, no big deal. And if you don't sleep well, take a sleep pill. If you don't feel good, take antidepressant. And by this time, I saw what can happen to my patient, happen to me. And I don't want to go to that path. And just by simplicity, I met a pharmacist who introduced me bioidentical hormone. So I started using it. It did help me sleep and reduce my hot flash. And the thing is, it happened. There's a book coming out of actress Ken Summers. Remember 20 years ago, there's a big study coming out from Women's Health Initiative says that hormone treatment causes cancer.
Yes.
And in her book, she talked about bioidentical hormone. So a lot of women drop out from taking Prim and Provera, and they're looking for alternatives. And the company scientists who I know happen to be under the resources list in her book. So he got a lot of phone calls from women want to look for providers can do bioidentical hormone. So he referred those people. Overnight. I had a very busy practice to begin with, but really snowballed. So I had a chance to use adrenal hormone for women. And pretty soon I find out the sex hormone itself is not enough because there's adrenal hormones, there's thyroid hormones, they all work together. And also we have a lot of environmental toxins that interfere with the hormones. And now the gut health because the gut and brain are connected. So once I got burned from using hormone on patients with side effect, I started to dive in why this happened. And that's why I started to take courses. 20 years ago, functional medicine was not well known.
It wasn't mainstream at all. It was only quacks doing it.
Exactly. But I really am grateful for the IFM Institute of Functional Medicine. I took a course, a whole week course there, and it really just changed my view of practice medicine. I'm very grateful for that education. And from there on, I also attended other conferences. The bottom line is I use what I learned to practice not on myself, but also on my patient. And I have a large amount of patient population, and I was able to quit taking insurance because the results I get was so much better. People would rather pay cash to see me.
Yeah.
And that's why I was able to quit taking insurance almost about 20 years ago.
Wow. So you're a trailblazer. You were one of very few MDs back then. There were a lot of clinicians that would go into functional integrative medicine, but the MDs and the DOs, DOs were still shunned back then. So, the MDs especially, they really didn't, start, other than a few of you, they really weren't paying attention to this back then. So that's really cool story that you were doing that. So
I want to tell you, I want to
tell me.
I was viewed as my medical community as a traitor, and when my patients, they have great results, they went back to tell their doctors, they said, "Oh, there's a voodoo medicine's whack."
Well, now we know because I've spoken with enough MDs to be able to say unequivocally that functional medicine is more science-based. There's nothing wrong with conventional medicine. We still need it. If your arm is cut off, you still need to go to the ER. If you need surgery, you still need to go to a conventional doctor. But the functional medicine, working on the root cause, is much more science-based than conventional medicine. So it's out now. So the MDs know now, and it's up for them if they want to choose to pick it up or not. But that's why we're here today. We're educating them. So let's dive in. So female testosterone deficiency is often overlooked in conventional care. Why do you think that is? And what are the signs providers commonly miss?
Well, typically people think testosterone is only for men. It's not for women, right?
Right.
But it's not true. Women has testosterone too, but only about 10% of men's testosterone. And where does testosterone coming from? Adrenal glands, because adrenal glands' main functions handle stress. First job is to make stress hormone. The second job is to make DHEA, and DHEA turn to testosterone and progesterone. So the three sex hormone, estrogen, progesterone, testosterone, before menopause, partially the progesterone and testosterone are from adrenal glands. Okay. After menopause has to be mostly from adrenal glands because ovary doesn't work anymore. Okay. So nowadays, perimenopausal women, their adrenal, many of them has adrenal burned out. Because now women has full-time job, they have 2-3 kids, they have a husband, they have parents to take care of. Their plates are full and they burn their adrenal gland because women typically are caretakers.
Yep.
They don't take care of themselves.
Right.
So by the time they reach menopause, they have adrenal burned out. So you have no source of sex hormone from either adrenal gland or from the ovary, right? And what symptom do they have? What does testosterone do for women? It's the same like men. It builds muscle. So you don't build muscle and you gain weight, right? And also it gives you increase your neurotransmitter, dopamine,
Okay.
pleasure, sex drive, and mental clarity. And serotonin, all those hormones are not just supported by estrogen, but from testosterone. And as a matter of fact, the major hormone for women after menopause is testosterone. It's not estrogen.
Wow. I'd never heard anyone say that.
Yes. Have you seen older women? They are bald here.
Yes.
They have beard coming out here.
Yes.
That's because before menopause, the estrogen for women, estrogen is here, testosterone is here, right?
Right.
After menopause, estrogen go way down. Testosterone go down a little bit, not way down. So before the ratio was like this, and after menopause, ratio is like this.
Okay.
Okay. So that's why testosterone is very important in women. When you don't have enough testosterone, you have mental fog. You lose interest in life, including sex drive. And you gain weight because you don't build muscle. Doesn't matter how much exercise you do. So that's not being recognized. I've seen so many women come to my practice with pretty bad menopausal symptoms. I can tell you 90% of them has adrenal burned out. Because when women don't have adrenal burned out, their menopausal symptoms is not that severe.
Okay.
They say, oh, I sell through and I, no problem. But the problem is later on, 10 years later, they have what? Osteoporosis. They lose their memory. They get bladder infection. They gain weight. They say, oh, I'm just getting old.
We hear that a lot from my functional doctors, especially the women functional doctors, that they hear that a lot. And they're like, no, it's not age, it's hormones. So let's talk about the misdiagnosis, because you touched on, how you can kind of feel down and, tired and lethargic. So there's a lot of misdiagnosis you had mentioned in your book about how modern medicine is kind of failing women, midlife women, about how they're being prescribed antidepressants for these symptoms, which is just a hormone issue.
Right.
You want to touch on that a little bit?
Okay, I'll give you a real case example, which I see quite a few, but this woman is striking me a few years ago. That was right after COVID. She says during COVID time, she's a full-time, she works full-time. She's a mother of two, and she was feeling overwhelmed and very fatigued and moody. Her mood was very not good. So she went to see her internist, and she was prescribed antidepressant. She didn't feel too much better and make her more tired. And then she saw a psychologist and did some psychotherapy, helped maybe a little bit, not too much changes.
Yeah, the psychologist can't take the work and the two kids and everything away. I mean, they can only do so much.
Right. And then because then she reached her period become irregular, and she was even more moody before the period. So she went to see her gynecologist, and her gynecologist prescribed her a birth control pill to regulate her period. But with birth control pill, because it suppressed the function of the ovary, so she has no testosterone from ovary, right? So she had no sex drive after that, and she gained weight. And then she had mental fog, so she saw a psychiatrist and gave her ADHD medicine.
Oh my God.
So on her journey, she says she's been on this drug for 4 years before she found me. 4 years.
Wow.
So when I saw her, I did test. She adrenal function was, her hormones were very low. And she was perimenopause, so not totally menopause. So I just simply help her sleep better by using progesterone and DHEA, because DHEA suppresses cortisol at night, and magnesium to help her sleep better. And I give her testosterone implant. If you want to know what implant is, I'm going to talk a little bit more. Within 1 month, all her symptoms improved. All her symptoms. She didn't need to take her ADHD medicine anymore. Her mood is so much better. She can function. She sleep well. Her energy improved. And on her intake, she said, I just want to be able to be intimate with my husband again. And she came back, says, yeah.
Great.
1 month.
1 month. That's amazing. I'm sure most people listening to this podcast will know what an implant is, but for me and for the other laymen that might be listening to the show, is that the pellet that you do? It's subcutaneous. Am I saying that right? Subcutaneous?
Yeah, I want to tell you a little bit about that, because bioidentical hormone means the chemical structure is the same as our own. So we have estrogen, progesterone, and testosterone. The key is, how does those hormones get to your body, right? So most common one is transdermal, which is a patch.
Okay.
Okay. The problem is, if you don't absorb it through the skin, you're not getting the hormone into your body, right?
Okay.
So if you're using a cream, if you forget, at that time, the mental fog is a major issue. If you forget to put it on, you're not getting it either, right?
Right.
And I remember early years, I was trying the patch too, because patch I have to change every 3 days. And I forget to change it. And then I wake up middle of the night, I had hot flash, you know? so that's the drawback of cream. And the patch only has estrogen, and you have to use progesterone, testosterone all separately. So it's kind of a lot of work.
Is it, just so we understand, when you say separately, is it in pill form? Are you getting a shot?
Okay, cream.
Cream. Okay, gotcha. So you're doing the patches and the cream. Oh my God, that's a lot. Yeah, okay.
I'm talking about the transdermal. And then next step is oral, taking orally. Okay.
Right.
You can take progesterone orally, you can take estrogen orally. That's what most doctors are doing now currently. People are using bioidentical already, but they are ignoring testosterone. But any hormone taken orally go to your liver. Okay. And liver, it can trigger inflammation. And also any hormone you take orally will affect your gut microbiome.
Oh, okay, right. I didn't think about that.
Okay.
Okay.
And also any hormone you take orally goes up and goes down within 24 hours. So the hormones like this, they are not stable. And normally producing our hormone, we are more even. We are not up and down like that.
Right.
Okay. So that's a drawback of oral.
Okay.
So the third type is sublingual, under the tongue.
Okay.
So sublingual, it gets absorbed under the tongue directly through the bloodstream. So it goes to, excuse me. So it raises the level in the blood right away, up and down within 12 hours. The hormone I use this is progesterone, because it really helps you sleep. Okay. But estrogen, if you go like this, you become moody. Okay.
I'm 54, so I'm shaking my head. Uh-huh.
Okay. So if you don't do it transdermally, you don't put it under your tongue, you don't do it orally, what else do you have? That's a pellet implant. It's a little tiny bit like this, the size of a gram or a rice. You put underneath the subcutaneous tissue. It's like when you put a soft rock in the river. Each time the water goes by, rub on the surface a little bit and take a little bit of the ingredient out. So it's in your body 24/7. It's almost like your own ovary is back.
Mhm.
Okay. And you don't have to think, oh, did I take something orally? Did I put something on my cream? It just works on its own. When you're exercising, you have more blood flow, then more hormone comes out. You're stressed, more hormone come out. If you're sleeping, you're relaxed, less hormone come out. It's supply by demand.
Oh, interesting.
Okay. But here I'm going to tell the drawback. The drawback is the dosage. If you put in too small dosage, it may not last long, or you don't see too much improvement. But you put too much, you get side effect. What side effect? Too much testosterone, you become a teenager, raging teenager with acne popping out, or aggressive, or or you have breast tenderness, you had menstrual bleeding, so on and so forth. So to do this is not easy because you have to focus on not just the sex hormone, but because all the hormones are connected. You have to think of adrenal hormone, you have to think of the thyroid hormone, and you also have to reduce the toxin in the body because a lot of toxins, they are adrenal hormones. They affect our bioidentical hormone. And women are so afraid of breast cancer. And breast cancer is not caused by bioidentical hormone because if high estrogen causes breast cancer, young women has the highest estrogen, right?
Right.
Why they have the least breast cancer?
Makes sense.
So it's the older women has more environmental toxin. We call that adrenal hormones. Those are the two causes of breast cancer, plus lowered immune system when we get older.
Okay.
Those combined together lead to cancer. So you have to take into, that's why when you do this pellet treatment, you have to do function medicine. You cannot just do the pellet treatment only without thinking the function medicine part. You have to detox people. You have to work on their gut. You have to reduce your stress level so the adrenal can recover. If you don't do that, you won't get good results. If you do the whole thing, people's life transform.
So the pellet works better when everything else is working better. Is that what I'm understanding you're saying?
Right. So you have to treat
Okay.
the whole thing together.
That makes sense. Treating the whole person. So talk about dosing a little bit, because you've got so much experience, so many years of working in this field. For other practitioners that might be listening to the show, how do you come up with the right dose? Like, how do you figure out what is the right dose for that pellet for that patient?
Okay. Ginger, I have to tell you, I learned from a mistake. My years of
That's
doing,
okay. Yeah, that's okay.
so
That's
they,
how we learn, right? We never learn from doing everything right. We learn from our mistakes, right?
yeah. Even IFM, a lot of places said, oh, don't do pellet, it's dangerous, and so on and so forth. It's not reliable. That's because they don't know how to do it. And they are organization, I don't want to say their name, they teach people to do the pellet, but only the procedure, and they give you the wrong dosage. And they don't do function medicine.
Okay.
Okay. So that turned people off because you can see people have bald here, they become too aggressive, they gain weight, they couldn't sleep. So you need to do it right. And that's one of my mission. I want to teach doctors who are already doing function medicine. They want to branch out to this method of a very effective delivery. I can help them. Really given my 20 years experience in 2 days.
Okay. Great.
Yeah.
That's great. So they can come and train with you in your clinic. Is this something that you're offering, or is this something that is this something that you currently offer, like a course for physicians to come in and work with you? Or is this something that you're thinking about doing in the future? What is it that you're offering here? I want to make sure I'm clear.
Okay. I've been doing this for a few years. I actually trained about 15 providers, including MD and the physicians and nurse practitioners and DOs.
Okay.
So I do have a program already. It's a PowerPoint presentation about how to do the function medicine with the entry point of the bioidentical hormone pellet therapy. And then they can come to my office, my clinic, and follow me and do the procedure themselves.
Oh, great. Okay.
And also see the real patient.
That's amazing. Okay, that's great. I love that. And we're going to give you all the information on how to reach Dr. Sun at the end here. But I want to chat a little bit more about you. So for providers that you touched on burnout, and I'm so passionate about physician advocacy and burnout and preventing physician suicide. And, the bar is set so high for physicians. You're supposed to see 50 patients a day. You're supposed to take your notes home and work till 10 o'clock at night. And then you're supposed to be back in, the OR at 5 a.m. I mean, it's just unrealistic what the bar that's been set for physicians. So burnout and suicide is a huge problem. So for providers that are navigating burnout themselves or struggling themselves with, midlife women, type things, what are some practical strategies or some mindset shifts, I should say, that you would recommend?
Okay. Any burnout, there's two things. Number one is environment. Number two is personality. Okay. Both are hard to change. But for me, I changed my environment because I was doing conventional medicine. That caused me to burn out. But now I'm doing functioning integrative medicine. I'm so joyful. I don't even want to retire.
I hear that all the time on my podcast, how happy all these providers are. And it just brings me great joy.
Right. And personality, I will tell you, most people in medicine have type A personality. Me too. Okay. We're high strung. We have to do things our way, have to be perfect. And so I really start to look into myself and do a lot of reflection. What's important to me? I think once you reach 50, you think you realize your time is limited. You're not going to be here forever. Okay, what's most important to you? How you want to spend your time? So I start to take care of myself because I didn't take care of myself before. I used to eat out a lot because I didn't have time to cook, right? So I changed my diet. I used to jump out of bed and run to the office, but now I do meditation, I do yoga. I give myself 1 hour in the morning and 1 hour at night. And I took a 2-year course to be a mindfulness meditation teacher and really changed the philosophy toward life too, because I want to tell you, I was born in Taiwan, which is not a Western country. So basically, Eastern and Western are different in many ways looking at life. So I have the benefit of looking life from different point of view.
Yes.
And I would say the Western society is very individualist. You want to overcome the environment. You want to fight. Okay. But the Eastern environment really is you want to be in harmonious environment with people, with nature. And do more is not as good as do less. That's why the Tao, the one theory is do nothing. The best way is not pushing, to follow the flow. So I think I naturally have that in me, and I can look things more from a holistic point of view. When you think of Chinese medicine or Ayurveda medicine, they've been around for 5,000 years. And do you call them non-scientific? Not really, because they work, right? Otherwise, they won't be around for 5,000 years.
Right.
And you can see the similarities. Both type of medicine, they focus on nutrition, right?
Mm-hmm.
There's food, there's medicine. they focus on exercise. That's why there's yoga, there's qigong, right?
Yeah.
And so I think the conventional medicine, when you think of Western medicine, at most 100 years, they have something to learn from the 5,000 years tradition.
For sure. Well, yeah, it's even been proven now scientifically with the blue zones theory, that was done on Netflix about Okinawa, Japan, and how there's more centurions than anywhere else in the world. And, it's because they meditate and they eat healthy and they move every day and they, keep active, and they're very social people. They spend time with their families, they spend time with their friends, they're not isolators. And you're right, Western culture is very individualized, right? It's all about, how can I make more? How can I do more? What can I do for me? And I think, going back to, taking that time, slowing down, allowing the universe. It's funny because today my internet went down at 4:00 and I got a text message. Your internet's down, and we're estimating it'll be back at 6:30. So I texted my assistant and I said, we might have to reschedule Dr. Sun. And she's like, would you like me to reach out? And I said, no. I said, we're going to let the universe decide if it would like for me to meet with Dr. Sun tonight or not. And I'll be home around 4:30. And if the internet is not back up by the time I get home, I will email Dr. Sun and let her know. But I came home and the internet was working fine, right? So I try to really allow the universe to guide. And it's hard sometimes, right? Because you're like, I want to get that podcast done. I've been so excited to have her on the show. No, the internet's down, right? And your head can go crazy on you. But if you just turn it over to the universe and you say, you know what? If the universe wants me to have this podcast, I will. Yeah. It takes all that stress away.
Yes. Yes. Yes.
So it's been such a pleasure having you on this show. I've been so looking forward to having you on the show. And I would love for you to tell practitioners how they can reach you for the training that you provide, both for the pellet training and also for the the mindset training. What's the best way for clinicians to reach you?
They can reach me through my website.
Okay.
Google Karen Sun MD in Irvine, California, or my website is www.theintegrativewellnesscenter.com.
The Integrative Wellness Center. How could we forget that? That's an amazing domain name. Good for you. You must have got that a long time ago.
Yeah.
Well, thank you so much for taking time out of your busy clinic to be with us on the show. You're an inspiring physician. You're a trailblazer. And, I know that other clinicians are really going to resonate with having somebody like you. And, if you're questioning whether this is for you, just hit Dr. Sun up on her website and she'll be happy to give you a more science-based reason why you should be looking at this medicine. Right?
Right.
All right. Thanks, Dr. Sun.
Thank you, Ginger.
Have a great night.
You too.